Hello, and welcome to the Texas Rights Educational Series. This session is being recorded and will be posted on the texasrex.org's webinars page if you want to review the content or share the information with your friends and colleagues. Our speaker today, Tony Gilman, will be speaking about health information exchange, how to connect to your local Texas HIE and upcoming HIE news. All attendees have been muted to block out background noise. If you have questions for our speaker, please post them in the chat block of the GoToWebinar pane. Your questions will be read to the presenter at the end of the presentation. If we are unable to answer your questions during the allotted time, you will receive an answer via email. First, some information about our speaker. Tony Gilman is the Chief Executive Officer of the Texas Health Services Authority, THSA, a nonprofit corporation created by the Texas legislature in 2007 to promote and coordinate the development of electronic health information exchange in Texas. Prior to joining THSA, Gilman served as the Executive Officer for the Texas Healthcare Policy Council in the Office of the Governor and was responsible for the strategic operations, planning, and coordination of all meetings of the council. Gilman also served as an advisor to Governor Perry and his senior staff on healthcare issues, including health workforce and regulation, health information technology, health system transparency, and health system reform. Prior to joining the Office of the Governor, Gilman served as the Austin Director for the Texas Office of State-Federal Relations from 2001 to 2005. From 1999 to 2001, Gilman served as a policy advisor to Governor George W. Bush, and from 1994 to 1999, he served as a policy advisor in Governor Pete Wilson's Washington, D.C. office. Gilman received a Bachelor of Political Science degree with an emphasis on political processes and institutions from the University of Kansas. Thank you for joining us, and I will now turn over the webinar to Tony. Tony, the presentation is yours.
Great. Thank you so much for that introduction, Veronica. And thank you to everyone that's on the phone this afternoon for this Texas Regional Extension Education Series. We always appreciate the opportunity to provide information on what we are doing in Texas to increase the size and scope of health information exchange, while also maintaining a strong focus on building trust and confidence in health information exchange organizations, but also in just the general exchange of patient health information across private and secure networks. So today I'm going to talk about HIE Texas, but before I do, just a little background that Veronica already alluded to. I'm the CEO for the Texas Health Services Authority. The THSA was created in 2007 by the Texas legislature as a public-private entity to promote and coordinate electronic health information exchange. As you can see from the next bullet, the state of Texas was well ahead of the federal government in focusing on health IT and health information exchange. So we were ready when the federal government, through the HITAC Act in 2009, created the State HIE Cooperative Agreement Program and funded state planning and implementation of HIE across the United States. Through that Cooperative Agreement Program, the state received $30 million in funds. The Health and Human Services Commission, our state Medicaid agency, was the fiscal agent for that funding, but they contracted with the THSA, given our statutory charge, to coordinate and implement state HIE in Texas. Working with the Health and Human Services Commission since 2010, THSA has supported the planning, development, and implementation of local HIE networks using much of the $30 million in funding that the state received. And the THA continues to provide support and coordination for local HIE development, including the creation of HIE Texas, which is a state-level infrastructure, which I'll talk about a little more. Just to provide a little more background, the State HIE Cooperative Agreement Program, the federal funding program ended in March of 2014, and the THA has taken on the full responsibility following the conclusion of that program of coordinating HIE in Texas moving forward. So the future of healthcare is about greater use of technology, and where doctors and hospitals are increasing using technology to capture patient health information. 50% of doctors' offices and 80% of hospitals now are using electronic health records. And since the EHR incentive program through the federal government began in 2011, we're seeing a pretty significant increase in the use and exchange of information electronically. According to the Center for Medicare and Medicaid Services, and I won't touch on all these, but we've seen 190 million electronic prescriptions that have been set. 13 million reminders about appointments, required tests or checkups were sent to patients. Providers shared more than 4.3 million care summaries with other providers when patients moved between care settings. I think that's one of the critical areas of focus of this federal initiative to promote greater use of technology and leveraging technology to share information to ensure the information follows the patient and to ensure the provider has the right information at the right time. So in terms of health information exchange, it enables EHRs to follow the patient, as I mentioned on the previous slide. So if they're seeing a new doctor, or they're traveling, or moving to another city, or if they're unfortunately in an emergency department in a hospital, through HIE, providers can have better access to the right information at the right time to provide the highest quality of care. But HIEs also benefit the provider. So as we look at particularly accountable care organization, bundled payment, patient-centered medical homes, which are payment reform initiatives occurring both through Medicaid and Medicare, but we're also seeing these through the commercial payers as well. Providers are taking on more risk and having greater access to more information, ensuring that as a provider you can follow the patient through the healthcare continuum, knowing that if one of your patients has been admitted to an emergency room, receiving some sort of notifications that you can track your patient is all very important under payment reform to providers, particularly as providers take on more risk. And of course, there are requirements under meaningful use beginning in stage 2, and we anticipate in stage 3 there will be additional requirements related to use of health information exchange. So the value proposition really is, from our perspective, for HIE, is it reduces hospital admission and readmission rates, and this is particularly important to hospitals now that there are penalties associated to readmissions. It improves patient safety by reducing medication and medical errors, reduces duplicative testing, and increases the overall efficiency of healthcare system and provider practices. And I'm sure many of you on the call have heard these types of statements over time, but this is just not academic now. We're seeing this in the market now that EHRs and HIE has been in place for several years now. And again, I won't cover each of these, and you guys will have access to these slides, but we're seeing actual studies about reduction in hospital admission and readmission rates that are resulting and hospitals seeing savings. In a case in Memphis, Tennessee, it was in nearly $2 million. In Cedar Rapids, Iowa, they were able to reduce hospital readmissions by 14%. And from an international study in 2013, we see that the readmission decreased by 40% overall, and 27.2% when compared with viewing only information available in the local electronic health medical record system. So health information exchange is playing a critical role and can play a critical role in reducing hospital readmissions. It's improving patient safety. So according to a study published by the National Center for Biotechnology Information, incomplete information adversely affects care in 44% of clinical visits, 18% of patient safety errors, and 70% of adverse drug events could be eliminated. Poor communication of medical information at the transition points is responsible for as many as 50% of all medical errors and up to 20% of adverse drug events. And according to an American College of Emergency Physicians study in 2013, nearly 90% of the 231 clinicians said using health information exchange improved the quality of patient care from their perspective. And it reduces duplicative testing. A study published in the Journal of Medical Care found that emergency departments using health information exchange were 8.7% less likely to repeat CT scans, 9% less likely to repeat ultrasounds, and 13% less likely to repeat chest x-rays. So that's real savings to the healthcare sector, but there's also a real patient value as well, because that reduces the exposure of patients to harmful radiation. So there's that's an additional positive impact to the community as well. And then, of course, the last piece is it increases the overall efficiency of healthcare. Again, according to the ACEP study, access to HIE saved more than $1 million in patient charges at almost $2,000 per patient annually. And 80% of the clinicians surveyed said that using HIE saved valuable time. A study that was occurred in Arizona said that participating hospitals are projected to realize a net positive cash flow in only 2.3 years. And over a 10-year period, overall return on investment would exceed 117%. So we are, again, seeing some studies based on real-life HIE activity, and then based on that activity, we're better able to extrapolate the value for HIE going forward in some communities as well. And then, as I mentioned in the previous slide, there's also a real impact for you as a provider participating in the Meaningful Use Program, if you're participating in the EHR incentive program through Medicaid or Medicare, because there are requirements under Stage 2 that relate to electronic health information exchange. I've highlighted the 3 of them here. The most critical one is Measure 2, which requires that a provider electronically transmit a summary of care for more than 10% of transitions of care and referrals. And 10% is a relatively small percentage number, but it's an important step forward for HIE, and it's certainly a requirement of the program that the provider organizations should be focused on as they work to comply with Stage 2. And providers should anticipate that this requirement will increase under Meaningful Use Stage 3. So what are we doing in Texas to support health information exchange? The THSA is building a statewide network of local HIE networks which we call globally HIE Texas. And the goal is to ensure a patient's health information does follow them regardless of where they receive treatment or where the information is stored. These local HIE networks enable the secure electronic exchange of patient data and provide immediate access, which improves health outcomes, saves lives, and reduces costs, as I mentioned in the previous slides. At the heart of HIE Texas and everything we're working on at the THSA, it's important to emphasize that a strong security framework that protects patient data, ensures that patient preferences and privacy are respected, is very much at the forefront of everything we work on. So there are three key goals that we focus on in supporting HIE development in Texas. The first is we supported a very decentralized approach and developed a network of local networks. So early on in our planning and then development operational steps, we recognized that what made sense from a health information exchange standpoint in Austin may not make sense to providers in Dallas-Fort Worth, Houston, in the Valley, in El Paso, and providers in rural West Texas may have a totally different view or value proposition for HIE than what providers in major urban centers may see. And so we wanted to take a very decentralized approach, and that's what we've operationalized in Texas. We also wanted to identify ways where we could create some efficiencies for our local HIEs. And so we've supported what we call a hub and spoke model to connect our local HIEs and leverage connections to reduce costs for HIEs to connect to other data sources and to connect to the National eHealth Exchange, for example. And the goal is to ensure that the large costs associated with supporting multiple interface and electronic connections to multiple data sources are not passed on to provider organizations downstream. We also wanted to have a consistent legal framework for exchange so that we're all operating under the same rules of the road. And having that consistency will reduce costs and reduce involvement of an expensive legal and attorney costs going forward. And then finally, we want to support an automated consent management process, recognizing the different organizations across the state, particularly given the way authorization and consent are managed in state law in Texas, that there would be differences. Some organizations may have an opt-in consent policy where patients have to opt in to share their information. Others may have an opt-out policy where all their information is shared unless the patient indicates that they want to opt out for sharing that information. So we need an automated way to recognize those differences in consent approaches for the sharing of patient health information. And then finally, we want to build trust, both in the HIE organizations that are supporting these networks, community networks across Texas, but also to support privacy and security at the covered entity level, which includes physician practices, hospitals, other healthcare organizations, other organizations in general that touch protected health information or are involved in the exchange of that information. So in terms of the decentralized approach, again, we supported a network of local HIE networks. And the map on the right shows the 10 local HIE networks that have been operationalized since 2010 in Texas. And these are the areas that they cover. Each of these HIEs has a diverse governing board that includes physicians, hospitals, payers, pharmacy, lab, but they were required to have those types of participants. But they may also, depending on the geographic area and depending on their priorities for their local HIA, they may have long-term care, mental, behavioral health. They may have a Department of Defense present, a Veterans Affairs presence, depending on their individual communities that they're represented in. All of them offer query-based and direct-based secure messaging exchange, and you can think of query as secure Google-type exchange, where you're querying for a patient's information and you're able to pull that information to your screen to view. Direct-based secure messaging is a push-based technology that is encrypted and secure. It would be the equivalent of encrypted and secure email. All HIEs at a minimum support the clinical summary exchange, so the exchange of patient summary records. They also support lab results delivery. And the reason they support those two items is because those are two items required under the EHR incentive program's meaningful use requirements. But many offer other value-added services. So some offer patient portals that cut across the entire healthcare continuum within their community, so that patients can view all their information in one place. Some are offering event notification services, so if a patient is admitted, discharged, or transferred from a hospital, for example, a notification goes out to the providers that have a relationship with that particular patient, so that they're aware with what is going on with that patient in the community. Others are offering analytics services and population, specifically population health analytics, so that provider organizations participating in the HIE can look at what's going on in the community. They can pull information for their own respective organizations to better understand how they're treating patients, so they can monitor if they've implemented a new policy initiative to perhaps address a disease that's prevalent in their community. They can better understand if that new policy initiative over time is having any impact on the disease within the community. So our HIEs are offering these other value-added services. The participants vary by HIE, but they include physicians, hospitals, health plans, particularly the Medicaid, CHIP managed care organizations, public health, and other healthcare organizations like long-term care, home health, and federal qualified health centers. We have one HIA that's working with their local jail system, another that's working with and very much focused just specifically on the safety net population within their community. So it varies by HIE and really is dictated by what offers most value to the providers within the community that are participating in the health information exchange. So in Texas, as I mentioned earlier, we really started with focusing on the development of local HIE networks. And those HIE networks were very focused, and we held them accountable to communicating and connecting provider organizations to them. And that was largely the focus of what we worked on from 2010 to 2012. Beginning in 2013, the THSA began and fully deployed HIE Texas, which is our state-level shared services network, which is designed to connect local HIEs together. So, for example, the HIE in Greater Houston, the HIE in Harris County, Greater Houston Health Connect, is connected to HIE Texas. They are technically connected, and so is the Austin-based Health Information Exchange Network Integrated Care Collaboration. And so providers in both of those communities can query and view information in both of those communities. So if a patient from Houston is traveling and were to get in an accident, for example, and be admitted to an emergency room in the Austin area, the Austin area provider organizations could query Greater Houston Health Connect to determine if there's any information available in Houston that might be helpful, such as a drug allergy or any other type of any kind of other problem lists or medical history that would be important for an emergency doctor to be aware of to provide the highest quality and safest care. The other area of focus for HIE Texas beginning in 2013 was to technically connect to the eHealth Exchange, which we've done. So any local HIE connected to HIE Texas also has a connection to the eHealth Exchange. The value of connecting to the eHealth Exchange is that is the primary mode that federal agencies want to connect with provider organizations. So the VA, the Department of Defense, the Social Security Administration for disability claims determination, which are largely paper-based now, but they want to move to do those more electronically. The CDC and Medicare as well all want to connect electronically through the National eHealth Exchange. And then other states, other provider organizations are connecting to the eHealth Exchange as well. We are currently preparing to test with the Kansas Health Information Network, which is obviously another state connected to the eHealth Exchange. And the reason there's value in that for Texas is that there are Kansans, particularly in western parts of Kansas, where it's closer for them to get care in Amarillo, Texas, than it is for them to go to Wichita, Kansas, Kansas City, or Denver, Colorado. And so being able to support that connectivity with Kansas is important for our providers in West Texas. And of course, we're focused on our border states as well. We're in the process of testing connectivity with Presbyterian, which is the largest IDN in New Mexico. The state of Oklahoma and the state of Arkansas have both indicated that once they are connected to the eHealth Exchange and that that's very much within their roadmap, that they want to leverage that to connect to Texas. And we fully anticipate that that's the way we'll be able to communicate with Louisiana as well as the other Gulf states in the future. And then finally, through HIE Texas, providers that are connected to local HIEs will be able to connect to other state-level data sources, particularly those of our state agencies, like the Texas Medicaid and the public health data repositories managed by the Department of State Health Services, including the immunization registry, the cancer registry, the state lab for reporting purposes. Those are all things that we are focused on providing more efficient connectivity through HIE Texas. We are currently testing connectivity with the Department of State Health Services right now through their public health gateway to provide connectivity to those data sources. And the value is that many of you are probably already connected to the Department of State Health Services for reporting purposes now. But if you're, and that connection costs you money. You have to maintain, you had to set up, you had to implement an interface, you had to, and you have to maintain that interface connection, and there's costs associated with that. And so if you're also connecting to a local HIE network, there's costs associated with that too, implementing and maintaining an interface connection. And so if we can leverage that connection through the local HIE to allow you to meet your legal reporting requirements to state agencies, there's value in doing that. And so we're going to try and leverage the infrastructure we're developing for HIE in Texas to put downward pressure on costs for providers that are required to report information to the state. And then finally, just drilling down on the kind of the last key goal I mentioned, we're focused on building trust, and we're doing so through what we call the Texas HIE accreditation program. We've partnered with a nationally recognized third-party accrediting body, the Electronic Healthcare Network Accreditation Commission, in September of 2013. Public and private HIE organizations operating in the state will be recognized for meeting and maintaining accepted uniform standards in the handling of protected health information. The program is designed to increase trust in HIE efforts and improve interoperability within the state, with increasing the goal of with the goal of increasing the number of physicians and patients participating in health information exchange. And it's really meant to provide kind of a gold seal of approval, so that a provider organization that wants to participate in an HIE, if they're accredited, they will know that they're private and secure, that they're interoperable, so they're not connecting to a silo, that they are participating in HIE Texas, that they have a sound sustainability model, and that they are a legitimate business in Texas. But going beyond that, it's also important because a health information exchange network is only as secure as its weakest link. And so looking beyond health information exchange organizations, we also have to look at those organizations that may connect to an HIE. And so we partnered with HITrust, which is, again, a nationally recognized organization that's focused on security certification. About 85% of all hospitals, payers, pharmacies, PBMs use HITrust to regularly certify their compliance with security, state and national security requirements. And we're utilizing HITrust's Common Security Framework to certify organizations for compliance with both federal and state privacy and security requirements. Covered entities in Texas may apply for Texas certification only, which primarily relates to just as it would imply Texas privacy and security requirements, or apply as an add-on to the HITrust certification, which is much broader and includes federal requirements as well. The Secure Texas program is really focused on covered entities, and covered entities, as I alluded to earlier in the presentation, are very broad. So it's the major healthcare participants like physicians, hospitals, dentists, other healthcare organizations, but it also includes organizations that support the healthcare community, which could include and may touch protected health information. That could include internet service providers. It could include organizations that may shred paper for healthcare organizations, or perhaps store either electronically or paper based information for a healthcare organization. And so this program is really aimed at all covered entities that, that touch protected health information in any way, shape, or form. The value in utilizing this state-sanctioned certification program is that it builds confidence with your patients. It gives healthcare consumers greater confidence that health information remains protected. It meets and serves as a security risk assessment, allowing entities to meet the HIPAA high-tax security requirement. Importantly, also provides a state law mitigating factor. So a court or a state agency or the Attorney General in Texas shall consider whether the covered entity had certification through the THSA as a mitigating factor. And so if your organization were to display or provide protected health information in a way that is a violation of the Medical Records Privacy Act, there are penalties and law associated with it. But a court, a state agency, and the Attorney General have to consider certification through the THSA as a mitigating factor, which would likely result in a reduction of the penalty. Similarly, at the federal level, the Office of Civil Rights and the Health and Human Services Agency at the federal level must consider the history of prior compliance with the administrative simplification provisions under HIPAA in determining any civil money penalty that they levy. So participating in Secure Texas is another way to protect your organization against a potential future penalty at the federal level as well. So where are we in terms of progress for HIE in Texas? So we spent much of 2010 and through 2012 doing planning and development. Our HIEs, local HIEs, as well as the THSA through the development of the HIE Texas state level infrastructure, implemented and operationalized their HIE in 2013. And beginning in 2013 and continuing in 2014, we're seeing data exchange occurring throughout these local HIE networks. And as I mentioned, we have two of our local HIE networks, the network in Austin and Houston, that are fully connected through HIE Texas as well. Healthcare Access San Antonio is currently conducting connectivity testing with HIE Texas. So they should be connected soon as well. In terms of kind of stages of development, if you look at the National eHealth Initiative definitions for stages of development of a health information exchange, you'll see that all of our HIEs are either just below or operating at a very advanced level. And in many cases, they're sustaining themselves, and in the case of two HIEs, are innovating in terms of the products and services that they're offering through their HIE operations. In terms of raw numbers, if you look at both query and direct base exchange, I talked about I kind of talked a little bit about what both of those mean earlier. We have a little over 2,000 physicians that are actively connected to our local HIE networks. We have 72 hospitals, and then we have 773 other providers connected, actively connected at this time. And to provide some perspective, that's about 8% of active physicians in Texas and about 10% of the total number of hospitals in Texas. We have a similar number of connected on the direct base side as well. In terms of the total number of clinical and administrative staff enabled for query-based exchange, meaning that these HIE organizations have legal contracts in place to technically connect, we're over 32,000 at this point, and we fare very favorably across the nation. We're second behind only the state of New York in terms of the total number of clinical and administrative staff enabled for query-based exchange. And as you can see, from October of 2013, we continue to see this upward trajectory in terms of providers enabled, and we anticipate this will continue to increase in the coming years. Similar on the direct-based exchange, push-based exchange, we've seen a steady increase from October of 2013 through August of 2014. So probably the biggest question is, what should you do if you're interested in joining an HIE? So the first step is determine which HIE or HIEs are covering your county that you practice in. And I provided a link to an interactive map on the hietexas.org website to help you determine which HIE is covering your area. So I would encourage you to review their profile sheets on hietexas.org to ensure you understand what services the HIE is offering, the technology model they are supporting, their approach to privacy and security, and of course the fees for participating. And I think it's also important to contact the HIE directly to learn more and to learn how to sign up to participate. And then finally, if you decide to participate in the Health Information Exchange Network, I would also really encourage you to get involved with the HIE through its governance process to help to ensure the HIE is meeting your needs and the needs of other providers in your community. I think it's important for HIE as it continues to evolve that in order for HIE to be sustained, that it has to offer value. And the way it offers value is to have continuous ongoing input from the provider community so that the services being provided are really meeting the needs and supporting the types of services that providers want and support within a community. So if you're interested in learning more about anything I've talked about, I provided a link to our main website, hietexas.org, some additional information on the Secure Texas Covered Entity Privacy and Security Task Force, and then a link to the Texas HIE Accreditation Program as well. And with that, with just about 15 minutes to spare, I'll stop. Thank you again for participating in today's call, and I'd be happy to answer any questions.
Thank you, Tony. And yes, we have some questions. The first one that I see is, what is the return of investments for ancillary services to participate or invest in an HIE if the goal is to reduce utilization of those services?
So, as I mentioned earlier, I think the return on investment is particularly for provider organizations involved in Medicaid or Medicare, or perhaps a commercial payer payment reform initiative, is there's potential for advanced incentive payments for care coordination. There is a better opportunity to manage your risk by understanding where your patients are and helping to support their care coordination across the care continuum, particularly if you're only getting one payment for that patient's care through payment reform. But then also there are potential cost savings. So, and we talked about those a little bit earlier in terms of reduction in tests, reduction in lab orders, things of that nature.
Okay, thank you. The next one. What tie-in does Texas HIE have to national sources and, in turn, global sources in an effort to promote national and global population management?
So, in terms of the national connectivity, we are technically connected to the National eHealth Exchange. We are currently testing with Veterans Affairs and the Social Security Administration, and as I mentioned earlier, we have started testing with a number of other states connected to the National eHealth Exchange that are ready to test with us. The Department of Defense, who's going through a major procurement for their electronic health record system now, has also indicated an interest in doing connectivity testing with Texas. And so we're not fully connected with those federal agencies, but we are in the process of doing that now.
Okay, thank you. The next one. What is the sustainability model for the 10 community-based HIE networks once the federal funding runs out?
That's an excellent question. The sustainability model was something very much a part of their planning and development process. And these local HIEs were required to develop a sustainability model early on and report on it over time. And the direction all of our HIEs are going is based on their sustainability will be based on subscription fees that they are charging their participants. So it's either an annual, quarterly, or monthly subscription fee that's being borne by the participants of the HIE. And that's how they anticipate they'll sustain themselves going forward. At this point, the sustainability of our local HIEs is heavily reliant on hospital participation, and pretty much across the board, physicians are financially contributing as well, but at a much smaller scale. And then payers, as I mentioned earlier, particularly for the managed care organizations involved with their Medicaid and CHIP population, are also beginning to financially contribute for a very limited set of data. They're looking for event notification information so that they understand when their patients are admitted, discharged, or transferred. Information they get access to eventually, but they want more timely access to it. So a combination of subscription fees and then strategic investment with the payer community based on support from the local provider community is what will sustain HIE going forward.
Okay, thank you. The next one. Is there an additional cost for HIS participation?
I'm sorry, for a what participation?
For HIS, HISP.
So all of our HIEs offer direct based services. So they offer health information service provider services, and there are cost to use to participate in the HIE network, but that is one of the services our local HIEs offer. But as many of you probably know, there are other providers, health information service provider organizations that are operating in this space that also offer those services. And then, of course, your electronic health record may have a health information service provider, direct-based secure messaging service provider, tethered to their EHR technology that providers can use. My only word of advice to providers is that you understand what trust bundle or trust framework is being used by that health information service provider to ensure that health information service provider is trusted by others, and that you can actually exchange information with other organizations.
Thank you, Tony. There's another question. Who takes the bonus of responsibility when using PHI from sources other than their own doctors?
I'm sorry, can you repeat that question?
Yes. Who takes the bonus of responsibility when using PHI from sources other than their own doctors?
So, well, I think that's an important question. The state law is very clear on what type of authorization and consent is required if it's used for another purpose other than for treatment, payment, or general health insurance administration. For treatment, payment, or general health insurance administration, patient authorization is not required. But if you're going to use a patient's information for research, if you're going to sell the patient's information, there are very specific authorization requirements associated with that. And then the other piece I would kind of note that's kind of related to that is that health information exchange is new, and I think providers some providers are leery about how use of health information exchange may be viewed in a medical malpractice suit or in an investigation conducted by the Texas Medical Board. And that's very much a focus of the Texas Medical Association. It's been something that we've been working on jointly with the Medical Association as well as the Hospital Association. And I anticipate that there will be legislation filed this coming legislative session in 2015 that would provide a safe harbor to physicians, hospitals, other healthcare practitioners using health information exchange to protect them from liability. And I think that's important just because we don't really know or don't have a lot of case law to really provide good information on how that's is going to be utilized in those types of med-mal suits, or how the courts are going to interpret use of health information exchange. And so that's an important policy issue that we're working to address with the state-level professional associations.
Thank you, Tony. Due to the time, we're going to have to stop with the questions and answers. I have some more questions, but we will get back to you by email with those answers. Now, we would like to give a mini advertisement. Carson Scott from the West Texas Health IT Regional Extension Center is going to talk about the services we offer. Carson, are you there?
I am. Thanks, Veronica. Yeah, well, thanks for letting me come on here real quick. I won't take much time at all, but just wanted to provide some information for anybody that might be on there that may not be a client of the Regional Extension Center at this time. You can see our contact information up there. That can pretty much reach any of us. That's our main number. But With all the services that Tony was talking about with HIE, those are some things we can educate you about a little bit further and help you get connected as well, if those are some things that you're needing. In addition to that, we provide all technical assistance support for specialists, PCPs, any healthcare organizations that are out there in West Texas with meaningful use gap analysis. We're working with stage 1 and stage 2 meaningful use assistance now. We're able to help provide you all with the tools and support to complete your security risk analysis that's required to hit meaningful use. Help a lot with incentive payments, all the audits that go around that, attestation support. Workflow mapping is a big service we provide to help clinics and hospitals just maintain a little better flow in the use of their electronic health record and how they do services. We can help you select an EHR if you don't have one. In addition, we provide services to help understand what's out there with patient-centered medical homes and HCOs and help provide some of that support to get you guys where you need to be along those lines. ICD-10 transition support. We know that got pushed back a year from last year, but it's coming soon, and it definitely need to be moving in the right direction on that. So if you need some help knowing how to prepare for that, we can do that. And in addition to telemedicine, telehealth support services, we're working with the Texas HIE TRC and the telemedicine department at Tech as part of rural and community health, part of all of our programs. So there's a lot of services we can provide there if you have any telemedicine needs or questions at all. So in addition, all these services are available throughout West Texas. One thing I wanted to pinpoint as well, there's a Medicaid physician specialist program that we are offering, and it's for any MD or DO practice out there that has more than 30% Medicaid in their practice, and it's the specialists, specialists only. But if you're out there and you need any of these services, that is a fully funded program, and so if you serve more than 30% Medicaid, then you're eligible for that. You can sign up for the Regional Extension Center, and we can help you at no cost for those. And that actually includes the North Texas region around Dallas and Fort Worth and those things as well. We're able to help those providers on that same program. So if you're in any of those areas and you want some more information about our services or the Medicaid Physician Specialist Program, telemedicine, any of those, please feel free to contact us at the information up there on the top. And that's about it. Thank you.
Thank you very much, Carson. Now I just want to thank our speaker for taking time out of his busy day to share his knowledge with us. If you have any questions for today's presenter, please email Texas Rec using the email shown, and we will make sure you get an answer. Please join us next month for our next educational webinar in the series. We will be presenting meaningful use attestation for both Medicaid and Medicare. It's going to be on December the 3rd, and hope to see you there. Thank you for attending today's webinar. Goodbye.